the treatment of stroke. So in treatment of stroke, there are two broad categories: acute stroke treatment and preventive stroke treatment. In acute stroke treatment, there is something called as thrombolysis and mechanical thrombectomy. We have already discussed about this. Any time when there is block in the arteries, the blood is not moving forward, and within 10 seconds, there is irreversible damage to many of the neurons. And as the time progresses, the damage to other neurons also progresses. So, time is brain in stroke management. So, we have to act immediately and treat them accordingly. So, even though we have lost many of the neurons before the patient realizes that there is a problem, still there are certain options to us. That is thrombolysis, where we give clot-busting injection to dissolve the clot. So these clot-busting injections are given in certain individuals. There are certain criteria for which we can give and we cannot give. And once we give, the idea is to dissolve the clot and to save as much as neurons as possible. So when we are saving the neurons, it in turn helps in recovery. So one important point about clot-busting injections are that it is not that once we give, suddenly it will improve. For some people, it will definitely improve. But for majority of them, long-term recovery is better compared to not giving the injections. So what are the risks involved in this thrombolysis? So for even without giving any injections, there are certain people who can have bleeding without any treatment also after stroke. So once we give this injection, the risk of bleeding is doubled, little high compared to not giving. Even though the risk is there for the bleeding, many of the times bleeding is very small, which needs only observation. Very rarely, but which do happen, where the bleeding can be more and may require surgical intervention also. But majority of them do well with these injections, and we are trying to prevent long-term damage to the nerves. So this risk has to be taken and it has to be understood. There can be some people where it can cause certain side effects also. Coming to mechanical thrombectomy. Mechanical thrombectomy is a procedure where if there is any big clots in the arteries, where we can go through the leg artery and we can bring it out. So we can dislodge the clot and bring it out. That is called as mechanical thrombectomy. Generally, if big clot is there, we will give thrombolysis if you have come early, and later mechanical thrombectomy will be considered. So now the time window for mechanical thrombectomy in certain individual, majority is 6 hours, but as in day progresses, technology, medical advances, the time boundaries are being breached every single day. And now for 24 hours also we will consider in selected individuals based on the criteria and clinical scenarios. So coming to the treatment, once the stroke is established, after giving the medicines, we will repeat a scan after 24 hours, make sure there is no bleeding, and start them on blood thinners, that is also called as antiplatelets medications. So these antiplatelets is given only to prevent further strokes. So for the stroke which is already happened, there is no specific treatment except physiotherapy. Coming to the rehabilitation part of stroke management. Here, one concept you have to understand, that if one of us has any problem, our family, friends, neighbors, and well-wishers will come to our help. Same way, when stroke happens, certain amount of nerves are damaged permanently, but however, there will be clinical recovery. How this recovery happens is that the adjoining neurons which have been saved, or the normal neurons which are there, which are supplied by other arteries, will take over the job of the damaged nerves and the recovery happens. So for this, most important point is physiotherapy, in the sense, if there is any weakness of hands or legs, if there is any imbalance in walking, gait and balance therapy, if there is any slurred speech, speech therapy, if there is any swallowing difficulty, swallow therapy, all those things has to be done. Once we do it routinely, the brain also realizes that these are important functions and depute other neurons to the job. So that's how the recovery happens. Maximum recovery happens at 3 months, and at 6 months some recovery happens, at 9 months some, and by 12 months most of the recovery is complete, and very rarely there will be any recovery after 12 months.